Can doctors deny you pushing in certain positions? For example, on your hands and knees or standing versus on your back in the typical lithotomy position. My name's Sydney. I'm a labor and delivery nurse, and in my humble opinion, no, they cannot. No one, not even a doctor, can tell you what you can do with your body. And when it comes time to pushing, you need to do what feels right for your body and what is right for you and your baby in that particular situation. Something that is good to keep in mind is the doctor and the nurses and all of the healthcare team that is there to support you. They are also there to inform you of anything that may cause harm to you or your baby. So for example, if the baby's heart rate is really low, sometimes changing positions is what helps to bring the baby's heart rate up. Another thing that's good to note is if the doctor needs you on your back because the baby's shoulder is stuck or they need to do some kind of maneuver to help facilitate the baby coming out, for example, an episiotomy, all of this is done with your consent, but sometimes it has to be done really quickly. So these are reasons why your doctor might say, hey, I know we said we'd push on your hands and knees, but right now is one of those situations where I need to get you on your back so that I can do this maneuver to help get the baby's head from being stuck. These are conversations that you want to ideally have with your healthcare team prior to pushing. I get that that doesn't always happen, but if you have the chance to communicate that you really want to be able to move freely during your birth, even if you have an epidural, then that way they know ahead of time and they can talk about the different reasons as to why they might have you push in a certain position based on emergency situations that may or may not arise. Our job as your healthcare team is to guide you in making the right decision for you, your baby, and making sure you guys are healthy. Obstetricians are more comfortable with lithotomy. At least this is the obstetricians that I've worked with. Most of them are used to delivering in lithotomy. It leaves them the ability to do any kind of emergency maneuvers. They can see everything. It is an easier position for them to control tearing as well. But at the end of the day, it is your body. It is you who's going through this, and they are taught and do know how to deliver in multiple positions. That is just their preference. And what you need to take away from this is you have to advocate for yourself and what feels right for you when you are delivering your baby, while also listening to the advice from your healthcare team.